Good morning, everyone. This is Dr. Buddy Donaldson, and today we're going to talk about children's sleep apnea. So many of our adults know that their spouse will snore at night, and it can be real difficult for them to sleep sometimes. And so we have snoring appliances that can help our adults make fewer sounds when they're sleeping, and indeed sometimes will eliminate the snoring 100% and can help with cases of mild to moderate obstructive sleep apnea. But that's with our adults. So what about children? This is a new area of study, and we know that if children are having trouble sleeping, if they're tired in the morning, if they're having a hard time paying attention at school, they can be having children's sleep apnea. A pioneer in this study was Dr. Guimeno out of Stanford, and what he said was a child should make no sounds while they're sleeping. So if you hear your child having some trouble sleeping, if they're making some slight snoring sounds, if they're waking up tired, if they're having trouble paying attention at school, it is likely or possible that they have some type of children's sleep apnea. There are some children that have been diagnosed with mild cases of ADD and ADHD, and when the children's sleep apnea was eliminated, they were able to pay attention at school, and they no longer had their ADD or ADHD problems. So how can we try to help a child sleep better? Well, there's a couple of things that we can do that we think help the airway. Number one is weight loss. So if either an adult or a child is overweight, it will constrict the airway here, and there will be tissue that will build up here, and it's harder for them to sleep at night and easier to make a snoring sound. If the bottom jaw is sharp, both with adults and with children, and they lay back when they're sleeping, the bottom jaw relaxes back, and therefore it constricts the airway, and that can make it harder for them to breathe. So a bottom jaw that's sharp can create some problems too. Okay, another thing that can help with children's sleep apnea is removing the tonsils and adenoids. I actually had a couple of patients where once the tonsils and adenoids were removed, not only were they able to sleep better, but also some of the allergies that they were taking, they were able to take fewer allergy medicines. So that's another nice thing about treating children's sleep apnea. A lot of the medications that they're taking we can stop. So another way that we do it is using a palatal expander. The expander widens the upper arch, it widens the nasal cavity, and it allows you to breathe better through your nose, which is very important. Another thing that we would do, if the bottom jaw is too sharp, we can use appliances that help the bottom jaw swing forward. When the bottom jaw swings forward, it helps your airway in here and you can breathe better. We don't have an appliance that can make this bottom jaw grow longer, but we do have appliances that can help it swing forward some. And when the bottom jaw swings forward, that will open up the airway so you can breathe better. So those are the big areas that we have right there, and some of the things that we look for when we're trying to help our children with children's sleep apnea. So if you think your child is tired in the morning, having trouble paying attention at school, or if they're making sounds when they're sleeping, it's very possible that they have children's sleep apnea. If you have any questions, please give us a call at Donaldson 3D Orthodontics.